Hello and welcome to Autism Circle of Support's Autism Awareness Month, April 2024. This year, the theme of Autism Awareness Month is thriving and not just surviving. This year, we're focusing on not just autism awareness, but autism acceptance. What is it that we can do to ensure that people with autism are living life to their fullest potential? And what are we doing to ensure that people are integrated into society? So my name is Charlotte Dick. I am the CEO and founder of Autism Circle of Support. Today's session, we're going to be talking about autism, having a brief overview of autism, and also we're going to be talking about some of the interventions. We'll be focusing mainly on applied behavior and behavioral analysis. And we have today a guest speaker who is also a board member on the Autism Circle of Support, Tinola Alaye, and she will be talking about applied behavior analysis, and she'll be given an overview. So starting off, let's talk a little bit about my journey and my story as a parent of two boys with autism. So my name is Charlotte Dick. I'm the mother of Gabriel and Nehemiah. So Nehemiah is my 16-year-old and Gabriel is my 8-year-old. They both have a diagnosis of autism. Nehemiah was diagnosed at 3 years old, and so was Gabriel. So both diagnosed quite early on. And, we've had lots of interventions throughout the years. I'm also married to Philip, who is my wonderful husband, father to my two children. He is also very much connected within the autism world. We have, learnt together along this journey. And, it's interesting, it is challenging, it's not always, full of, a bed of roses, but, we are getting there. It has pushed us to where we are today. And, we are advocates of autism. I have a special interest in health inequalities, disparities in autism diagnosis and interventions, and especially focusing across West Africa, Ghana, and Nigeria in particular. I'm also a blogger. I have a page on social media, Facebook, Instagram called Our Autism Journey, which really gives an insight into the boys' lives on a daily basis. We have also been doing some lives recently in celebration of Autism Awareness Month. As parents, I've been collaborating with other bloggers across Facebook and social media who are also parents, sharing the ups and downs of being a parent with a child with special needs, and just being there to have that platform for other parents to relate to. So moving on to our next slide, what are we going to discuss today? What am I going to give you an overview of? So we're going to talk about the definition of autism. What is it? The word spectrum, it gets thrown around a lot. What does it mean? Looking at the prevalence throughout the world of autism, looking at the core features of autism, the causes, why does autism appear in more males than females, looking at the acceptance and the interventions. So when I asked all the attendees of the Autism Circle of Support, Autism Awareness Month, what comes to your mind when you hear the word autism? So this was done via Slido, and these were the kind of things and words that people were throwing out. So people, throw out things like superhero, thinking differently, someone who thinks differently, looking at people with different abilities, neurodiversity, different enabled, sensory, stress, interests. And you can see from all of those words there, we're talking about somebody who's neurodivergent, somebody who's not neurotypical, somebody who's neurodiverse. There are loads of different words that will come across. It really depends on where you are in the world, I would think, because it will depend on your cultural influences. It will depend on your knowledge of autism. But it's a good starting point for us to kind of get to where people are at the moment. So this gives me a good idea where you are, those who are involved in the meeting today, where you are and what your thoughts are about autism. And hopefully by the end of this session, you'll have a little bit more understanding about the autism spectrum. So the simple definition of autism is it's a lifelong developmental disability that affects how people perceive the world and interact with others. And that's taken from the National Autistic Society in the UK. So the term autism was first used by psychiatrist Eugene Bleuler in 1908, so quite a long time ago. So autism is not something new, even though we see a lot more people diagnosed with it. It is really, we are getting much, much better at recognizing the symptoms and being able to characteristics of autism and being able to diagnose. So the Greek word is autos, means self, and Bleuler used the word autism to describe morbid self-admiration and withdrawal with oneself. So what is autism? So autism, as I've said, is a lifelong condition. It affects people from all backgrounds. It appears more in males than females, but we need to be careful when we're looking at that. And I'll come on to that a little bit later on in the presentation, because even though it appears that we have more males, it's predominantly in males than females. Females are very good at masking those characteristics of autism. Many people are aware that they're autistic. So some people go through it their whole life not being diagnosed with autism, not knowing that they're autistic. But this doesn't mean that they just found out as an adult. It is because it means that they found out as an adult, but it was that they were always autistic. They were born with autism. It's just that they have, since they've become more aware and we're more aware about what autism is, people start recognizing those characteristics and start thinking, I might be autistic. Am I on the spectrum? And then people are going and being proactive and going to get diagnosed, and they're getting diagnosed later on in life. But then when they go back through and look at their history and look at their childhood, they can then see that those characteristics were always there, but they have learned to live with those and have lived a fulfilling life and have maybe struggled, but they get diagnosed when they're much older. So when we look at the word spectrum, this refers to a range of different characteristics. If you look at the autism spectrum, you can look at it as a rainbow of colors. So you have got loads of different colors of the rainbow, and one person with autism will not be the same as another person with autism. You will get somebody at the most extreme end who is down in the red area, and somebody who's at the, down in the purple area. It's not linear. It is very, very different. People will have similar characteristics, but they will all display quite differently. So autistic people will have a variety of ways that they experience the world. So some autistic people might need more support than others to live their lives that they want to lead, and others will be, quite independent. It really, really does vary. The way autism affects you, it can change as you grow, but it doesn't mean that somebody grows out of autism. So I've heard that thrown around quite a lot as I've gone through Autism Awareness Month and done a few talks. People have talked about, can you grow, asked questions like, can you grow out of autism? If my child is, a child with autism, will they be an adult without autism? No, is the simple answer. If you're autistic, you will be autistic for life. The symptoms you may see that the characteristics of autism, you may not be as prominent as somebody gets older, but that's been through loads of different interventions and therapies, and that person has learned to find ways around that. That person has learned to live with autism, and they're living well with autism. That is the main aim, is that somebody can live a most fulfilling life with autism, but they will always be autistic. Also, quite frequently, there's the terms high functioning, low functioning, and I can say within the UK, those terminologies are not really used anymore, because it leads somebody to believe that somebody's high functioning, they don't need as much help. And it was quite confusing, but actually somebody could be high functioning, described as, on very able to do things more than, maybe functionally, but could really struggle in other areas. So that's why they have, stopped using it. I know that they still use them in some countries, but it was felt that, it can be more harmful and minimize what people are feeling or what people are struggling with, or who are autistic. So the top 10 countries with the highest rates of autism, as you can see that the United Kingdom is right there at the top. So you would think, so the World Health Organization says there's 1 in 100 people who have a diagnosis of autism in the world. But when we're looking at the top 10, we can see that United Kingdom is within the top 10. We've got big places like Japan, United States. These are all countries that are, may are more aware, should I say, of autism. They have a better diagnosis process. And those that are not on the top 10 doesn't mean that they don't have as many people with a diagnosis of autism. It simply is really that they may not have those systems in place. So when we're talking about places like Ghana and Nigeria, do they have those things in place to be able to, or Sierra Leone, do they have those things in place to be able to identify autism? Also going through the diagnostic process, are they able to do that? And so that will also depend on where those people, where we are within the ranking. Also, another thing to say is that when I was doing this research and looking at the prevalence throughout the world, the United Kingdom is very good, and I'm from the UK, at diagnosing. But actually, when looking at the statistics, when we look at the United Kingdom, only a third of those people actually get to are in employment or able to do anything, with their lives. Also, the schools, there's not enough schools, it said, for people with autism within the UK, so that system is not working. So there's lots and lots and lots that they need to do. Autistic adults are not receiving that meaningful support or services from local authorities, that's our local governments within the UK, and really there is a lack of early intervention. So although we're better at diagnosing within the UK, and there's more people who have autism in the UK, there's also a lack of services for those who have autism. And so a lot of children might be out of education, a lot of adults with autism might not be having that support, and children in early years are not getting the early intervention that they should be. So what are the characteristics? So there are 4 main characteristics. Communication differences. So when we're talking about communication differences, we're looking at the differences in understanding, looking at, how people express themselves. Do they communicate verbally, or do they use picture exchange cards? How is that person communicating? They will have different ways of communicating. Even though they're non-verbal, does not mean that they do not have that, not able to have receptive language. They understand, good understanding, but unable to verbally communicate that. So it's about looking at how you can develop those skills. You'll see the first thing that people start talking about is speech and language when somebody gets diagnosed with autism. And it's about making sure that they have those language skills to be able to function throughout life, whether that's communicating through sign language using simple Makaton, or whether it's through picture exchange cards, or whether it is eventually for someone being verbal. So also sensory processing. So you might notice that sometimes you see people with autism will often cover their ears, usually because they have a sensitivity to sound. Now it's not every single person with autism. Some people with autism have different sensory processing needs. So I know a lot of the time when my son was younger, both of my sons actually had to wear ear defenders because they found it very, very difficult walking through noisy spaces, trains, buses, any public spaces, whereas I wouldn't notice that or pick up on that. It would be a lot and overwhelming for them. Also, I know that my eldest son didn't want to wear shoes. He always wanted to have that feedback from the floor. So it was really challenging going out because he would constantly not wear shoes, and people would stare at me and think that I was a really bad mother, but he just couldn't handle it, and he would have a complete meltdown if we didn't do that. Also, interacting. So there is a difference in perception, planning, understanding, and concepts of generalizing, predicting, imagination, They also sometimes really have a focus, very strong interest and passion on one specific area. And, it's that all that they will speak about. I know that my children have gone through loads of different very strong obsessions or keen interests in some areas. My young eldest boy, when he was younger, used to be fishes. It used to be everything fishes. Everything had to be a fish. He was really, really obsessed with it. And it can sometimes, be something that is also a trigger. So it has to be managed in a way that is you can basically control it, but also use it as a positive enforcer as well. So processing information, it's also about having sorry, so I said process, so interacting would also be the social understanding, the differences, understanding how they interact with somebody. Sometimes it might be challenging to build relationships, but it's just about how that person interacts with another person. They don't always pick up on those social cues. It's sometimes challenging. Eye contact, all those things that we see as the norm for somebody, as we're neurotypical, somebody who's not neurotypical can find that really, really challenging and not understanding how they should react to somebody. And can always sometimes be very honest and open, and sometimes can get you could get the parents into trouble. So looking at exploring the characteristics further, autistic children may find it difficult to instigate or join in playing with other children. So you might notice that they're playing side by side. They're not actually really playing with another child. You'll see them play. They will normally say playing alongside, and that's what I picked up on. So when you go and you start having assessments for autism, you'll notice that they start asking you questions. When you see your child playing, are they playing with children? Do they play with another child? And you start picking up on those cues because all those signs, because you see your child that is playing next to somebody, but not actually playing with them. They're not looking at them. The other child might show an interest, in the toy that they're playing with and want to talk to them, but your child will, totally just ignore them. Not because, they're doing it on purpose, but that's just the way, their brain is wired up. So autistic children may find it difficult to take turns and share. This can cause problems with friendships. A lot of the times when you're looking at interventions and therapies, it will focus on turn taking. They can, and I know when I'm talking about they can, I say my children often used to, and the Gabriel is still does this. He finds it quite difficult to share. Well, if he sees something he wants, we'll just go and take it. And it's something that you have to work on. It is a learned skill, and you need to integrate that into therapies and do, this is turn taking. That's why it's important to do when you're doing therapy to do group therapy as well, include the other children, can be neurotypical children, and that also helps inclusivity and integration into, settings, because our children, even if they go to specialist schools, when they grow up in the, big wide world, they will have to be integrated into society. So these are the skills that you have to learn as they grow up, and very important to do so. So developing and maintaining friendships and relationships. Friendships and relationships are difficult for people who are autistic, uh, not to try and find they find it particularly difficult. Um, this does not mean that they do not want to have relationships and friends, but it can be challenging for them. So they do find it a little bit difficult. It's not that they can't learn it or they don't want to have relationships. A lot of people who are autistic are adults will have relationships, and they will definitely have friends, and it will be people who understand them, come to understand, the way that their brain works, the way their mind works. And also it will be that, they learn to pick up on social cues, and are able to live, fulfilling lives and have fulfilling relationships and friendships. So, autistic people may not engage in conversation in the same way and enjoy discussing factual issues rather than small talk. You may have to be very specific when you want to bring into a conversation to an end. They will not sometimes, and I'm not saying what they will not. So some people should in with autism find it very difficult to pick up on social cues, will not read your facial expression, will not understand, pick up on that body language that we might pick up on when somebody's kind of feeling a little bit uncomfortable. It is just it's a process, and these are just some of the characteristics in autism. And like I said, that this is something that will be a learned skill. Autistic people may have difficulty in understanding the rules of social relationships, and this may cause many issues, including them offering truthful opinions rather than a tactful one. So I know that my children don't have a filter; they will just say what's in their mind, and I have to quite frequently just give them that look like stop, and they're like, what, mom, what, they are verbal. So my eldest one will sometimes say what he's thinking out loud, and it's not always appropriate, can sometimes get me into trouble. But it is something that is being learned, and he's getting better at it and being a bit more tactful as he's getting older. So, what causes autism? And I know that's what everybody wants to know. I know that's definitely what I wanted to know when my children were diagnosed with autism is, what have I done? Have I done something wrong? What did I do when I was pregnant? I felt like it was all my fault, especially having two children with autism. It's really, really challenging. And I would say that, I found it very, very difficult. I think more difficult second time around having my second child diagnosed because I felt, a real sense of guilt, that he was diagnosed with autism. So there is no known cause for autism yet. That is just, the short of it. We know that it's a complex neurodevelopment disorder, and the exact causes are just not fully understood. So there's loads of research going into it. There is some thoughts around it maybe being genetic. I mean, that would make sense because I have two children with autism, and some research have suggested it might be environmental factors that play a role in it. But it's really there's not enough known about it, and that's when we need more research to go into autism. My children are part of research and have been. My youngest was part of research. Gabriel, when I was pregnant, we were done just from pregnancy. I was having lots of MRIs and looking at his brain to see how it was developing, and that was all to contribute towards research. Even though I didn't know that he would have autism too, just know that there is a strong likelihood when you have one child with autism. So as you can see here on the right hand side, it's just showing you the areas of the brain structures that are implicated with somebody with autism. And it's just showing that how it affects you neurologically. So when we're talking about autism in males and females, the signs of autism in boys is more noticeable. I think that's why they get diagnosed more readily than girls. I think, that repetitive behavior, restrictive play behaviors. So you've got them more likely to struggle in the social communication in early life. They're more likely to have challenging or disruptive behavior to obtain terms, but sometimes it can just be dismissed as them being boisterous, which I got quite a lot. More likely to have perseverative interest in things like statistics and schedules, and more likely to be hyperactive or prone to distraction. So signs of autism in girls is more likely to mask in order to fit into social settings. Boys can do this, but it's really less common. Girls are very good at masking and usually get diagnosed quite later on in life. And, the reason around this is, girls will want to fit into society more. And so they often don't get diagnosed and get misdiagnosed with something else when they do start to become withdrawn. So you can see that there's some of those characteristics that go across, and they are the same in both areas. So I've just got a short clip here, and we're talking about acceptance as well today. So just to see how it is in the life of somebody who does have autism, what it feels like to be them. So I'm just going to try and share the sound for you as well. Hopefully that works. So let's just make sure we're sharing the sound as well. So I'll just play that for you. And this is from the National Autistic Society.
Two, three, four, five, 6, 7, 8, 9.
Take my hand.
I'm not naughty. I'm autistic. And I just get too much information.
So when we're looking at that, it's, I've been there so many times. People looking at me, the stares, people telling you that your child is naughty. I've had it, up to a couple of months ago, somebody told me I needed to control my child. He was having a complete meltdown in the supermarket. And, when we're talking about acceptance, we talk about the awareness. People know about autism, but it's about accepting that actually this is how this is how people are. These are the difficulties that people do have when they have autism. And it's about making sure that you are doing something to support that person. That mother in that situation doesn't need people giving her steers. That child in that situation doesn't need people who don't understand. When we're talking about the awareness, we're talking about can be done in society to accept that people who are autistic need adaptations. They want to be included. So they don't want to be excluded from certain activities. So something like going to the supermarket, they have things here where they have like a quiet hour sometimes, once a month in some supermarkets, which allows parents to go and do just a simple task like shopping at the supermarket with their child. The lights will be dimmed down. There won't be any music in the background when you go into the supermarket. And those are things that you don't recognize if you are not on the spectrum. But those things make a big difference. Being able to shop with other parents who are going through maybe the same challenges you and just feel relaxed. Shopping, just a simple task, can be extremely, extremely stressful. So hopefully that video gave you an insight into how that looks and how that feels to somebody who is autistic. So hopefully we can move on to the next slide if it allows me to move on. Just see, let's pause that and hopefully it lets us move on to the next slide. We're going to start talking about strategies and interventions. So let's just let my computer catch up. Just give disruption. So hopefully it will start going to the next slide now. So looking at strategies and interventions, prioritizing the dignity of autistic individuals. It's about making sure that we are tailoring everything we are doing, or people are working in health and social care, wherever you're working. It's about making sure if you're a parent, it's about prioritizing the dignity of that person, that individual with autism, ensuring that their safety, looking after their health and their happiness. Health is really a big one. When we talk about health, we're looking at things like simple things like making sure they have health checks at the GP. People with autism are always well, not always, but more likely to have poor dental hygiene, healthcare, health, should I say, sorry. It's always really difficult to brush teeth, and that can be due to sensory, could be to the taste of the toothpaste, loads of different things contribute to that. It's really important to keep that up. Also things like eye tests, regular eye tests and things, because it might be difficult for that person to communicate to you that actually I'm really struggling to see. And then some challenges can happen because actually that person is, struggling to see, the television or their iPad or read words. And so those are the things that you need to make sure that somebody who is involved with somebody's care with who has autism is looking at those. What can you do to ensure that might be therapies as well, looking at speech and language, OT, all those other things, and make sure that the person's happy. So whatever you want, is it what that person wants? What are we doing to ensure that they're happy and they live a fulfilling life? That's the most important thing. Because actually that person with autism, the things that we affects us may not affect them, and that is the norm for them. And we are living in their world, it's like they're living in our world, but actually, we're living in their world at that time. So enable them to pursue their passions. What is it that they're good at? What is it that they want to do? How can we help them support them to pursue their passion? Avoid attempts to cure autism. There is no cure for autism. So, this autism is a lifelong developmental disability. And it is about how we look at supporting that person to be able to learn those skills that they need to live as independent as possible. So we might notice that some of those characteristics are not as prominent as they were before, but it's not because their autism has gone away. It's because they've learned those skills, and now they're able to live life and be as independent as possible as they can, within their own remit. So refrain from using punishment. It should never, somebody with autism shouldn't be punished because they're not able to do something. It is about making sure that you are doing all those things above. Any therapies, any interventions that's in place is not about punishing. So lastly, I'm going to finish my slides on a poem. This is a poem that I picked up early on in my autism journey when my eldest was diagnosed with autism. I was really, really down. I didn't know what to do. I was grieving the loss of having a child that was going to be neurotypical. This was my first child. Be told about he was, all the time I was saying that there was something going on. I was dismissed. And then all of a sudden it was sprung on me that, he had autism. So this is a really lovely poem. It was written in 1987. So some of the areas may not be politically correct in what they're saying now, but it really, I think it will resonate with a lot of people. So have a listen and tell me what you think. So Trip to Holland is by Emily Pearl Kingsley. I am often asked to describe the experience of raising a child with a disability, to try to help people who have not shared that unique experience, to understand it, to imagine how it would feel. It's like this. When you're going to have a baby, it's like planning a vacation trip to Italy. You buy a bunch of guidebooks and make your wonderful plans, the Colosseum, the Michelangelo David, the gondolas in Venice. You may learn some handy phrases in Italian. It's all very exciting. After months of eager anticipation, the day finally arrives. You pack your bags and off you go. Several hours later, the plane lands. The flight attendant comes in and says, "Welcome to Holland." "Holland," you say. "What do you mean, Holland? I signed up for Italy. I'm supposed to be in Italy. All my life, I've dreamed of going to Italy." But there's been a change in the flight plan. They've landed in Holland and there you must stay. The important thing is that they haven't taken you to a horrible, disgusting, filthy, full of pestilence, famine, and disease. It's just a different place. So you must go out and buy new guidebooks and you must learn a whole new language and you will meet a whole new group of people you would never have met before. It's just a different place. It's slower paced than Italy, less flashy than Italy. But after you've been there for a while, you catch your breath, you look around and you begin to notice that Holland has windmills and Holland has tulips. Holland even had Rembrandts. But everyone you know is busy coming and going from Italy. And they're all bragging about what a wonderful time they've had there. And for the rest of your life, you will say, yes, that's where I was supposed to go. That's where I had planned. And the pain of that will never, ever, ever, ever go away because the loss of that dream is a very, very significant loss. But if you spend your life mourning the fact that you didn't get to Italy, you may never be free to enjoy the very special, the very lovely things about Holland. And that's where I'm going to end. So I'm going to hand over to Tinu. Tinu Alaya is a applied behavior analysis. She's based in Nigeria. She's going to give you an overview of ABA, and I know a lot of people were eager and keen to hear about ABA and what it involves, what it entails. And so I'm going to hand over to Tinu. Just on the screen there is our details for our contact details and social media. So if you're wanting to find out more about autism, so I've just realized that the actually the website is not correct there. So it's autism circle of support.com, not journey, and our autism journey. So on Facebook and Instagram. You can also see at the bottom there is that's the correct website, the autism circle of support.com. I will upload all videos to YouTube so people can watch it, and also to our website www.autismcircleofsupport.com. Thank you. Over to you, Tinu.
Yes, yes, I am absolutely. Thank you very much, Charlotte. Thank you for this opportunity, to be in the midst of all of these lovely people. Sometimes when you are at this side of this work, and you're providing intervention, sometimes you can be so caught up in the intervention, that even though the science that we practice always pulls you back, that you're dealing with people, the emotions involved, you're dealing with real people, So it's really important, it's really a privilege for me to be in your midst, and to share this with you. What I have to say, that is. So thank you so much, Charlotte, for this great opportunity. I would not want to spend the whole after, even just talking. I will go straight into my slides. Hopefully, oops, I can, yeah, I know I can find them. They're somewhere. They're somewhere.
You want me to share? Is that easier?
Yes. Oh, okay. No, I think, let me see. Let me just try again. I think I've got it. I think I've got it. Let me do that. Okay, yes, there it is. I have it. All right. So really, what I quickly want to do this evening is give an overview of applied behavior analysis as an intervention for the community for this community of children with additional and special needs. Yes. So I never want to go into my talking to parents or even people that are involved with children with special and additional needs without talking about how I fell into this world. Yes, but before I go into that, let me reintroduce myself. My name is Tino Lankechiolaya. I am an international behavior analyst as well as a qualified behavior analyst. Okay, so you see the BABA in both because I have certification from two different boards. Okay, we'll go a bit into that. I will explain a bit of that to you later on in my slides. So as I was saying, I never want to talk about any intervention, without letting people know how I actually got to be with this community of or to begin work. Yes, let me not say be with this company because I actually have always been with people, young children or people with special and additional needs. But being able to help, being able to do something that makes a difference is what I'm saying. So my fall into the world of applied behavior analysis, it was as a result of being a teacher that was teaching children and realizing that there were a group of children that I knew were not learning. Yes. How did I know? Because when the outcome, for learning was tested, it simply was not there. So I started to ask myself questions. I mean, what's going on with these kids? It cannot be them, or how is it that one can help them? And so that was my search, into applied behavior, my search for help, help for myself to be a better teacher, actually, was what led me into ABA, applied behavior analysis. And another story that I like to share when I started this journey is that I've met a lot of amazing kids. So when I think about autism or when I think about children with special or additional needs, I always see superheroes. I always see people that are able to do things that a lot of us are not able to do, you know. Um, one, one thing that stands out for me all the time, is that it was a child that had additional and special needs that ever told me. I'm sure some of us know the story of Jack and the Beanstalk. So I read the story of Jack and the Beanstalk to this 6-year-old boy. And when I was done reading that story, he looked at me and said, Miss Nkechi, what did the giant do? Jack was the bad boy. I had never seen that story from that point of view. Never is the word. You know, my typically functioning mind, um, accepted the status quo that Jacques was the Jacques was the giant was the villain and Jacques was the victim. But and that is it with quite a number of this kids. Well, all of them really. There is there is something special. There is something that they are adding to the big picture. And the big picture for me is humanity. You know, the big picture is not necessarily the family that they're from, it is humanity as a whole. So we have this community of children or people with special and additional needs that are here to contribute to the big picture. And we have to learn actually to help them so it is easier for them to make these contributions in their everyday life. And one of the things or one of the interventions that have been able to do this um, really well is applied behavior analysis. So I'll go straight into that. So applied behavior, applied behavior analysis, or ABA for short, is is a branch of behavior analysis. Okay, so behavior analysis consists of three major branches. I will try not to bore you with a lot of terms and terminologies, that is, yes. So ABA, or applied behavior analysis, is a major branch of behavior analysis. So so you have behaviorism, which is about the philosophy of the science of behavior. And then we have the research arm, which is the experimental analysis of behavior. And then we have the technology for improving behavior, which is applied behavior, analysis. All right, just one moment. I want to be sure that I have done all what I have on this slide to do. Apologies, please. Yes, yes. So that's it. So it is a part of. So another thing to know about this intervention, yes, is I always say to people, I start by saying that autism is one of those things that does not, I mean, you cannot do a blood test to discover that a child is autistic. You can't do it's none of those. Autism presents as behavioral deficits and behavioral excesses. Yes. So it is when these behavioral deficits or excesses begin to present in a child that red flags go up, and then we begin to say, oh, what's going on? And then we test. And then the test is usually not sort of like a blood test. So I always say to people that if you're dealing with a situation where you have behavioral deficits and behavioral excesses, what better intervention to embrace than one that is completely and totally focused to the study of human behavior? Because that is what ABA is. The focus of ABA is human behavior. The branch of it, behaviorism, is understanding how the environment works so that we can make ourselves smarter, more organized, more responsible. So what I'm trying to say here is that the mainstay of ABA, okay, is the belief that behavior and the environment are intertwined. Yes. And understanding how the environment works and making ourselves, setting up contingencies to make us more efficient in this environment is what ABA is about. So we can remake our environment to accomplish some of that more easily than you can remake a person. It is easier for you to set up interventions to remake the environment, yes, as opposed to trying to remake the person. Yes, so that is one of the approaches of ABA. Now, the applied in behavior analysis is very interesting. I mean, that is what makes ABA stand out from a lot of other interventions. The applied behavior analysis signals a commitment to affecting improvements in behavior. Yes. Now, what sort of behaviors do we focus on in an ABA intervention? Yeah, it is behaviors that will definitely enhance and improve people's lives. It is not just, we're not interested in any kind of behavior. We're interested in behaviors that enhance and improve people's lives. So, applied behavior analysis. One of the things I like to tell people about ABA is that first and foremost, it is a science. Yes. So what this means is that it has an area of specialty, and that area of specialty is human behavior. So what we do in ABA is that the interventions and the strategies that we use are from principles of behavior. And when we talk about principles of behavior, we're looking at how people acquire behavior. How do people acquire behavior? Yes. How do people behave? What are the contingencies that apply to our acquisition of behavior? So it is the focus of this. It is focusing on this, all right, that systematically improves human behavior of the community, of the people, of the children that we work with. Yes. So very important to ABA is that it is socially significant behaviors that we focus on. We do not focus on any type of behavior. We focus on only behaviors that are socially significant behaviors. And when we talk about socially significant behaviors, we're talking about behaviors that are important to the independence of the child, behaviors that will help the child not to be ostracized in school, not to be ostracized from family engagements, going to the supermarket, going on holiday, going to inclusive school, being in a general classroom, or even being in a co-ed classroom. So we focus on these significant behaviors, or these socially significant behaviors. And examples of those could be as easy as a child using a potty, knowing that the potty is for sitting and peeing, teaching a behavior like that, or teaching a child to communicate in whichever way, either with words or non-verbal communication. Yes. Now, another thing to look at is, why is it an effective intervention for autism? I sort of dived into that a bit earlier on, that autism presents in behavioral deficits and excesses, and ABA uses principles of human behavior. Yeah. And it is the main focus of the science of ABA is the study of why and how we behave. Yes. And if you look at the whole of, if you look at the presentations of people that are on the spectrum, of children on the spectrum, you will see that it's about, like I said earlier on, it's about behavior deficits or behavior excesses. Yes. Okay. And ABA is also the gold standard for treating children with autism spectrum disorder. It is definitely evidence-based. Another great thing about ABA is that it is individualized. It is not a one-size-fits-all intervention. And it can teach a variety of skills very effectively, ranging from academic skills to the simplest skills of using the bathroom, like I said, brushing the teeth properly, having a thorough bath. Yes. Social skills like initiating social conversations, teaching language, either vocal verbal language, or just verbal behavior to communicate a child's needs and wants. And I want to pause here too, because this is another thing that I like to talk about, is that a lot of people think that autism is synonymous with destructive behavior and self-injurious behavior. I would like to point to say here that those are things that come along for the ride. Yes, it is not a characteristic of autism. Those are behaviors that come along for the ride as a result of environmental variables. Yes, environmental variables, skills deficit, and environmental variables and skills deficit. Yes, it is very important for parents and teachers or people that work with autistic children to know that. Yes. Okay. Now, another reason why ABA is effective is that practitioners in the field of applied behavior analysis are rigorously trained, and we are bound by strong ethical codes. Yes. Now, having talked about what ABA is and why it is a good fit for people on the spectrum or children on the spectrum, or generally children with special and additional needs. Now, before I go into the slide, I would like to say that a lot of times people think ABA is synonymous with discrete trials, but ABA is beyond discrete trials. Discrete trial is one of the great methods we use to teach, to break down very complex behaviors. And when you talk about a complex behavior, you're looking at perhaps even say what you might assume is a simple behavior like hand washing. okay? But in the process of hand washing for a child that has a skills deficit, there are lots of steps, you know, in that very simple as it may appear, hand washing task. And so a discrete trial teaching helps to break down those steps and teach, of course, the discrete steps in that complex behavior as we look at it. Yes, but ABA is beyond discrete trial teaching because, of course, you can't teach social interaction, you know, with discrete trials. So we have the naturalistic environmental teaching. We have the contrived teaching. That is where we just manipulate the environment to teach skills by presenting different opportunities in the natural environment. Yes. So one of the things that parents or people should look out for when they want to begin the journey of, you know, an ABA intervention is to make sure that it has some of this, well, these characteristics majorly, is that the intervention, okay, is behavioral. And so when we talk about an intervention being behavioral, you must make sure that the intervention that you're engaged in is one that seeks social validity. Now, what do I mean by that? Is that the targets or what the program is about are actually things that serve the child. Because I say to people that what's the use of teaching a child to count to 1,000 if the child cannot request for things that they want? You know, they do not have a means to communicate that. A child wants to go to the bathroom in a new environment and they are not able to communicate that. A child is not, does not want to be part of a task, you know, and they're not able to say, I don't want to do this. I'm not ready to do this now. Yes. So it is very important that when you engage, when you are involved in an ABA intervention, that the program itself, okay, seeks social validity. It is also important that it's technological. What this means is that the interventions can be explained simply to you if you're the parent or you are a stakeholder. Yes, that the intervention can be easily explained to you. Yes, so that you will be in a position to carry it out. You know, remember, it seeks social validity. The behaviors that are being attended to in the intervention must be one that serves the child, serves the family. Yes. Must be simple to follow. Yes. There must be proof that it is what is going on in the intervention that is bringing about the change that you're seeing in the child, because that is a good ABA program. Yes. And that the interventions, because you should question the strategies of this intervention to say, the interventions should be based on principles of behavior. It shouldn't just be things that someone is pulling out of a hat. It must be tied to particular principles of behavior. Yes. There should be no resorting to default technologies. It is when ABA is not being done right that people or practitioners resort to what we call default technologies. And default technologies are arbitrary punishers, like regular people do. When a child does something, just slap the child's hand, stop it. Yeah, that's default technology, because you really have not proven that that thing that you just did by hitting the child's hand is going to reduce the occurrence of that behavior in the future, or it's going to serve the purpose of the child not doing the same thing in the future. Yes. So it is proper ABA that makes sure that an intervention is put in place, a proper intervention is put in place that is function-based, okay? That is function-based, so that we're not resorting to default technologies, you know? That's where you have a lot of punitive measures, yes? So when you see that in an ABA intervention, that's a red flag, yeah? That it is not function-based. Another thing about ABA is that what a good one would look like is that it's effective, it's efficient. Effective means it is doing what it says it would do. Efficient means it is doing that in good time, okay? Because there's no use teaching a child to go to use the potty. A child who comes to you at 6, who is wearing diaper, as your intervention is supposed to help the child begin to use the potty. And in 6 months, the child is still wearing the diaper. Yes? Okay, so it is also doable. ABA is also doable. That is, Parents should be able to carry out intervention. Like I said earlier on, it should be easily explained. It is accountable. ABA is accountable to stakeholders, people who are invested in the child, the child, people who are invested. And I keep saying child, this person can be an adult as well. Okay, so it's accountable to the person who is directly receiving the intervention, and accountable to the stakeholders, people who are involved with the child. Yes, ABA is public. There is nothing hidden about it. So if you're having an ABA intervention where say, oh, you cannot see this, or you can't come in, there's something going on that's not quite right, because ABA is public. It is public because most ABA programs, or after a child is assessed and diagnosed, hours of intervention are actually a lot. Sometimes there's a prescription of maybe 40 hours of intervention. And, that's quite impossible to get from any clinic or from any Head Start or from wherever it is that you're assessing the intervention. So it is very important. ABA programs make it mandatory that parents as stakeholders understand and know, some of the strategies that are being used to improve skills, okay, and reduce, self-injurious behaviors, etc., etc. Yes, because it is from stakeholders understanding the interventions that actually stretches the child's intervention. Because, like I say to people, ABA is not. It actually really becomes a lifestyle after a while with the families that are assessing the intervention. Yes, and ABA, of course, is optimistic and empowering. It's empowering because it makes, sometimes the change or the results are so surprising. They're so dramatic. Yes, but that is the science. Yes. All right. So another thing that I think parents, and stakeholders should be aware of is people that should be providing this intervention. Okay. So you should be sure that you have a board certified behavior analyst at the head of an ABA intervention. Yes, because yes, there are lots of YouTube videos out there. There are lots of 1 week courses out there that people register themselves for and come out and say they're behavioral science interventionists. So as a parent or as a stakeholder that is planning to assess or that is already assessing an ABA intervention, you must find out, you must be sure. And it's quite easy to find out, as easy as a Google search, just typing in the person's name, to know if they have a proper certification to be carrying out this intervention. Because don't let us remember that ABA interventions ought to be function-based, okay? And for any intervention to be function-based, there certainly should be a lot of analysis going on there. Otherwise, it becomes an intervention that resorts to default technologies. Yes? Okay. So, of course, we have different boards now. We have the BCABA, that is a board certified behavior analyst. The BCABA board from 2023 stopped covering, I think now only covers America and the UK. So any behavior analyst that is outside, or anyone that wants to train outside of these two countries cannot apply for or cannot be certified under the BCBA. Okay, but then of course we have the QABA board, yeah, the Qualified Applied Behavior Analysis Board. These cover countries outside America and the UK, as well as America and the UK, of course. And then we have the International Behavior Analysis Organization, which also is a board that covers countries aside from the UK and America, and of course UK and America as well. So you would have so the certifications that we have, you have the ABAT, that is the Applied Behavior Analysis Technician. Then you have the RBT, the Registered Behavior Technician. You have the IBT, the International Behavior Technician. Now, the technicians are those that directly carry out interventions, okay, that are put together by a behavioral analyst, yes? And then you have the International Behavior Analyst, that's a certification. You have the BCBA, certification as well, or qualification as well, which is a mid-tier qualification for the board certified behavioral analysis board. Yes. And then you have the qualified behavioral analyst, which is a certification that you get from the QABA board. I think it's important for parents to know this. So that, okay, that I think my next slide goes into that. Yes. Why is this important? Why is it important that you are not just going to anyone who says, oh, I am practicing, I use behavioral analysis, yes? Because remember, behavior analysis is a whole, is like, it's behavior analysis has branches, yes? And applied behavior analysis is one of the branches of behavior analysis. And so there are quite a few people out there who are saying, no, I'm just applying the principles of behavior analysis in the work that I'm doing. And so it is important for you to know why you must seek ABA intervention from certified professionals, yes? It is important because certified professionals are trained and are bound by ethical codes that put client and stakeholder interests at the center of intervention. Okay? It is important that you seek the services of people that are certified in this field, because the certification that we get in this field is not a one-off certification. It is a certification that we have to renew every 2 years. And to renew those certifications, you have to have met certain standards. Yes, certain standards of certain units of continuous education units in different areas. Yes, okay. Certified professionals are answerable to a board and have something to lose. Yes, they have something to lose, as opposed to someone who absolutely has nothing to lose. And it is also important to go to people who are certified in this field, because we're dealing with human beings. The people that we're doing these interventions for are human beings. Yes, they are people. And so it is important that you make sure that whoever is carrying out this intervention is the right person too. Yes, so as a parent, the power is in your hands. Yes, know that the profession of ABA is tiered. Yes. So if you have someone comes to you as a behavior technician, you should ask questions like, okay, so under whose supervision are you working? Yes, the profession is tiered, with the behavior analyst being at the top and a behavior technician or trainee behavior technician directly carrying out interventions. Certifications can be checked. Yes, ask questions. Ask questions about what kind of intervention you're going to be getting, you know, and all of that. What is a what program, what programs, you know, the child is going to be be under. Yes, it is important to ask these questions. Yes. All right. So my final one is to testify to what ABA does every day. ABA works. It works because it's a science. It works because it is evidence-based. It doesn't work because of individuals. So be wary of people. I think I missed out when I was talking about how to identify a good ABA program. Is a good ABA program will make sure that a stakeholder is involved. Yes, carrying out the intervention. It's actually about you. It's actually about the person directly receiving the intervention and the farmers. It is not good ABA if a child can do it in a clinic or in a particular environment, but cannot do it at home and cannot do it in the community. Okay, so that is why it is important that you know that a good ABA program is one that will carry you along every step of the way. and that will be accountable to you and answerable to you as a parent or as a stakeholder. Yes? So ABA works. If you're in Nigeria as a parent, please join the Association of Behavior Analysis in Nigeria, ABAN. We have different categories of membership, professionals um, who are certified in the science and professionals who are not, because and the and that's the great part of it. Okay, so and professionals who are not, because aside from ABA being a therapy, I always say to people, and maybe because of my training as a teacher, ABA is a teaching methodology. It is such a great teaching methodology. And so that is why in this association, we have categories of membership from people who are not necessarily certified in the science, because we know it is a great tool in the hands of a speech therapist. It is a great tool in the hands of an occupational therapist. We are aware of that. It is a great teaching methodology. So as a parent, if you're in Nigeria, please feel free to join Urban. I'm a program director at Two Head Starts in Lagos. Now, what do we do? It is a place where we prepare children for inclusive schooling. Okay, so where we just teach the behaviors that will make a child succeed, in school. Our success rates are great. Yes, myself and a team of certified behavior analysts also organize family trainings. Family parent training is such a key part of our intervention. In fact, for us, if a family is not willing to be part of this training, we do not actually take on the children, because we feel it is setting up the child for failure. Yes. So it is a key part. So of course, we do a lot of family training, parent training. We also, of course, organize professional training for those who are interested, who want to be certified in the science. We do trainings for teachers and interested individuals in this field. So yes, this is where I come to the end of my bavad.
So
Yeah,
interesting. I've learned a lot about and you've got your number there. You can type it in the chat as well for us,
right.
Tinu,
Okay.
so that people can access it. So if you
Yeah.
just I'm just going to stop you sharing for a minute and we're going to come back.
Mm.
So I know we've run over a little bit, but I wanted to, so thank you, Tinu. That was really interesting. So ABA within the UK, so I don't know anybody who's joining from the UK. It's not something that is what we use. Some people do use it, but I know that there's a lot of people on the call that use it in America and in Nigeria and across West Africa and loads of other countries. And lots of people have been asking, wanted to know more about ABA, wanted to hear about, debunking those theories. So it's really, good to hear the emphasis on making sure that the parent understands what's happening, the parent and the family are part of the process. It is it's focused on individuals, so the program is tailored to that child, and it's
Yeah.
not just that child needs to fit into this particular, putting a round peg into a square hole. It is about making sure that the program is tailored to the child. Also, just picking up on the emphasis of making sure you have a certified behavior and analyst, making sure that you are questioning. And I think it's important, whether you're a teacher, whether you're a family friend, whether you're a parent, is making sure any professional that's working with your child, you are questioning all the time. Because if you have somebody who isn't trained, that's the worst thing ever. You are putting your child, or even as an adult, somebody who's vulnerable, in their care, and anything can happen no matter where you are in the world. So I am gonna give 5. So we are well over time, but it's been really interesting. I'm gonna open up the floor for any questions to myself or to Tinu before I close the meeting. So if you've got any questions, please do put them either in the chat, or you can unmute yourself and ask a question. Fatima, was there something you wanted to ask? You were asking the spelling of Tinola's. I'll give it to you. So you're gonna have somebody. You're gonna have
Yeah.
loads of people contacting you. I know that too.
Yes, yes,
Uh,
yes, yes. Got it. You got it, Fatima. It's a liar. Yes, you got it.
is there anyone that has any questions that wants to ask before I